Hi there, Dr. Christianson here. I want to talk about spring allergies. We're having quite a season here in the Sonoran Desert, and many are strongly affected, but they can happen other times of year as well, fall or winter, indoor, but allergies are a big thing, and they affect many people. Sometimes they cause symptoms you wouldn't expect. There's the classic itchy eyes, runny nose, hoarse voice, dry cough, but some can also feel just run down. They just seem tired for no clear reason. Some find they're not sleeping as well, maybe tied to not breathing effectively. Some may notice just more aches and pains. And those can actually all come from allergies, from airborne allergies. So they work because your immune system is trying really hard to protect you. And in general, it's more apt to attack something harmless than it is to ignore something dangerous. So rather than miss some bad bacteria and have it hurt you, your body's going to make the mistake of attacking pollen because it kind of looks like the bacteria. And that causes all these symptoms. So thankfully, they're very manageable, but a lot of the common ways they're managed are not super effective. So in terms of medicines, there's not a lot of great options in all honesty. For starters, all the things that have D in the name, like the Zyrtec-D, for example, or Claritin-D, the D is decongestant, and it's a version of one that's not safe for those with thyroid disease. It actually does say that in the very fine print, but you can't take those decongestants if you have thyroid disease. It can be dangerous to your heart. So the other issue about the regular medicines is that they're in two varieties. They work and they knock you out, or they don't knock you out and they don't work. Here's why. So histamine, it's a pain in the butt when you get too much of it in your sinuses, but you need to have some in your brain to feel alert and focused and aware and energized. So the conventional medicines, they cross into the brain and they block it in your head all across the board, the sinuses, but also the brain. And that's why they use it as a sleep aid, Benadryl or diphenhydramine. So allergies are treatable, but more so by strategy and not so much just by medication. The first step to think about is hydration. So imagine your nose as being a garbage disposal. It kind of is. So the little blades of the garbage disposal, you've got things like that in your sinuses, and they continually pull pollen and debris back to your throat, where you can unload it in some way. Now imagine the garbage disposal when the water's not running. It's not very effective. Things build up and things get stuck there. It's the same way for your sinuses. So you want to hydrate inside and outside. So inside means drink lots of water. No real substitute for water. You want at least 3-4 quarts a day for most of us. And you want some version of purified water. Don't stress about RO or distilled leaching minerals out of the body. It doesn't work that way, thankfully. And don't stress about pH or magnetic things. Harmless enough, but purified water of some sorts, especially RO, works really well. And your thirst is not always a good indicator. It's totally possible to not feel thirsty and be chronically dehydrated. So do 3-4 quarts a day for a few weeks, and you'll probably feel more thirsty afterwards and have a more normal thirst response. The other part of the water is external. So the more you hydrate the sinuses from the outside during the tough times, the better they'll do. And two ways to do that. The easiest one is just saline sprays, harmless, somewhat helpful. The most effective thing is to use a neti pot, N-E-T-I. They're funny, they're like little Aladdin's lamps almost. And you take it, put warm water and some salt in it, and you pour it through. And it actually loops out and cleans the lower and the upper sinuses really effectively. Afterwards, a great trick is to take a Q-tip with some coconut oil and moisten the sinuses with that. That seals in the moisture from the rinse. So hydrating it pulls out all the junk and also makes the garbage disposal run better. It takes all the debris and lets your body move it out effectively. So that's one step. So then there's managing the histamine. And I mentioned how the medicines either make you go to sleep or they don't work. Thankfully, there's some really good natural antihistamines. My top 3 favorites are andrographis and quercetin and freeze-dried nettles. They work by slightly different mechanisms, but they all do a really good job at making your body less apt to pour a lot of histamine into your bloodstream. And the nice thing too is they're all quite harmless and safe, no real big drawbacks. Some usage ideas, The nettles is distinct in that it's the quickest acting. So it's one that you can take and see some quick effects in a matter of hours. The others can take a matter of more like a few days, but they may be stronger. So I really love combinations of the three of those. And then the nice thing too is that there's now good methods of desensitizing. You know, as a kid, I went through the scratch test and the allergy shots, and it was fine, whatever. I didn't like it, but it probably reduced some of the allergies. But it's come a long ways. You know, so blood tests are now much more accurate. They're way easier. They can check for a big variety of outdoor and indoor allergens. And even if your symptoms are seasonal, it's good to know about indoor allergens, because even if they're not the sole culprits, they may be contributing to make you more reactive. So sort both out. And along the same lines, it's also good to know about food allergies or food intolerances. They may not be the sole factor of your seasonal symptoms, but if they are affecting you, they will make the seasonal symptoms much worse. Along those lines, the biggest single food would be dairy foods. You know, many, even without big dairy allergies, see that if it's times of year in which they get symptoms, if they just cut out dairy even during those times, they get a lot clearer and a lot less symptomatic. So the other great treatment, when you've got a strong sense what your culprits are, is a thing called sublingual immunotherapy. So it's the same concept as allergy shots, but there's no needles, and you do it at home. It's a one-a-day daily spray, and over the course of commonly 12 to 18 months, you can turn off half a dozen or so allergens. And by turn off, it means they're gone, like you're allergy free. And future seasons, you can do things besides worry about your allergies. So they are treatable. They can be a nuisance. They can be a cause of hidden symptoms, but be aware of your allergies. Take great care, and we'll talk real soon.